12:23, coronavirus infections have increased exponentially among children across the U.S. in the last week. That's according to a well-known pediatric group. Mandy Gaither looks at where we stand on getting children under 12 vaccine eligible.
The war on COVID-19 hitting the young hard. The American Academy of Pediatrics reports more than 240,000 new cases among children over the past week. Pediatric cases now account for nearly 29% of all cases reported nationwide.
Before schools opened, we knew that children congregating and school districts without having mask mandates, children who are not able to get vaccinated, was a prime vector to spread disease.
In Georgia, the state's epidemiologist says about 60% of all COVID outbreaks reported in the past 2 months are happening in K-12 schools, an almost seven-fold increase. The state ranks near bottom of the U.S. when it comes to vaccination rates.
Yes, it's true that children may not get as sick as adults. They're not hospitalized as often. They don't die as often, but it can happen.
Right now, only those 12 and older are eligible for a COVID-19 vaccine, but that could soon change.
Based on what we know, it's going to be sometime in the fall.
Pfizer CEO confirming data from their vaccine for children aged 5 to 11 should be submitted to the FDA by the end of September.
And then it is up to FDA to take their time and then make the decision.
Pfizer also working with vaccine data for children as young as 6 months. The company saying that information will be available by the end of October or beginning of November. For Health Minute, I'm Mandy Gaither.
And pediatrics, or the American Academy of Pediatrics, says the weekly case number reported this week is about 240% increase in child COVID-19 cases since last week in July. Well, the National Institutes of Health wants to study the mysteries of long-term effects of COVID-19. The agency has awarded nearly $470 million to New York University, Langone Health, for a large nationwide study. The study will enroll up to 40,000 participants, including adults, pregnant women, and children. Now, the CDC estimates that 10 to 30% of COVID-19 patients experience symptoms for at least 1 month. And some good news, the CDC says the number of new COVID-19 hospitalizations will decrease over the next 4 weeks. This marks the first time a decrease has been predicted since June 23rd. The CDC did not make a prediction on whether new cases would decrease, but the agency is forecasting the number of deaths will remain stable. Now, there have been roughly 664,000 COVID deaths in the U.S. since this pandemic started.